got a question here on how to improve Humira for Crohn's disease. Got here someone who's had quite a few issues in getting this approved, had a couple of rejection letters. How do we get this approved? So the first step you're going to need to take is to figure out what type of request this is. So there can be two situations. Number one, it's on formulary and it has a prior authorization, and you need to just meet the criteria for the prior authorization. Number two, it's not on formulary and they want you to take a different medication. If the second situation is the case, since in this example it is on the formulary and it does have a prior authorization, if it's the second situation where it's non-formulary, you're going to have two choices. You can either take the medication that's very similar to it. It's probably going to be some other antibody, tumor necrosis factor inhibitor, whatever the stuff is. You're going to take something very similar. You can choose to do that, or if you really want Humira, then you can do the non-formulary medication process, in which you're going to have to use the non-formulary medication process video that I used, that example, and you're just going to go through the steps. You're going to find out what the alternatives are. You're going to list those alternatives as you have tried those, and if you do that, it will be approved. But if it's on formulary like this one, and that's what it sounds like from your statement there, then all you're going to do is look it up in the formulary search tool like I've done here. Click on the prior authorization criteria, and now because this has a lot of different indications, or it's just another word for uses, you're going to want to look up your specific condition. Crohn's disease, you're going to see stuff here. Rheumatoid arthritis, right there, it's the first one. Plaque psoriasis. So it's used for a whole bunch of different stuff. You're just going to keep scrolling down until you see Crohn's disease. Sometimes places will have a little bit more organized than this one. This one's just a massive block, so it's a little bit inconvenient to read. But eventually you'll see Crohn's disease, and then you just read that criteria. For inducing and maintaining clinical remission in patients with moderately to severely active disease, and patient has failed to respond to at least one steroidal therapy, and a list of medications: budesonide, hydrocortisone, prednisone, prednisolone, methylprednisolone. So you can see that the prior authorization criteria is actually pretty simple. It's two parts. Part number one, you need to state that you have active Crohn's disease. Number two, that you've tried at least one of these steroidal therapies. And if you're at this stage in the disease, you will have certainly tried at least one of these: budesonide, prednisone. I'm just going to use prednisone for the example since it's probably the most common. So you're going to have two statements on there. Statement that you have active Crohn's disease, and then statement that you've tried at least one of these medications, and that's it. It really is just that simple. You just need to make sure that you submit it for Crohn's disease. Now you're going to look around here, you're going to see a lot of stuff that looks very similar. You just need to make sure that you pick Crohn's disease, satisfy that information, and then proceed to step 3, which is just to submit this information to the insurance company. Before you call the insurance company, you're going to want to fill out this rubric. Write it down on a separate piece of paper so you have it handy when you're on the phone. And this serves two purposes. Number one, to make sure that you've got all the information necessary in order for the insurance company to make a decision on your case. And number two, to make sure that you don't forget anything when you're submitting to the insurance company. What I'm going to suspect from your personal case, what you describe as having filed a couple of prior authorizations and having the insurance company taking weeks in order to even get back to you on it, what I'm going to suspect is that when your doctor's office submitted for this prior authorization, they were missing one of these basic pieces of information. And while it seems very insignificant in many ways, the drug strength, the drug quantity, even the frequency, things like that, it is required in order for them to make a decision on your case. If they're missing any of these pieces of information, then they cannot make a decision on the case. It's not approved or denied. They have to do what is called pen the case. Normally, a case has a compliance time frame, which means legally they have only a certain amount of time in which to make a decision on the case. Let's say normally it's about 48 hours. The only time they can step outside of that 48-hour window is if there's insufficient information on the case in order to make a decision. So if your case is taking longer than a couple, if it's been a couple days and you haven't heard back from your insurance, then in all likelihood they're missing one of these pieces of information. It could be any of these things. And what the insurance company is going to have to do is call your doctor's office in order to get that information. And of course what can happen is they call the doctor's office call back, and they just keep missing each other. They can pen this case for up to 2 weeks. After 2 weeks, if they still haven't made a connection with the office, then at that point they're going to deny it for whatever piece of information that they're missing. So that's why it's important that you fill out this rubric and make sure, no matter how trivial something on here seems, make sure that it is filled out. Okay? Otherwise, it's just going to be exactly what you've been going through all this time. So let's go through it. The drug name, Humira, drug strength, the strength of the pen, whether it be 20, 40 milligrams, whatever it is, the drug quantity, so how many pens you're getting, the frequency, how often you're taking it, the doctor's name, the doctor's fax, the diagnosis for Crohn's disease, it's 555.9, and the rationale for the request, has active Crohn's disease, has tried and failed prednisone or whatever other drug you saw on that list there. Only now, after you've filled out this entire rubric, now you call the insurance company. And again, make sure you write it down. The last thing you want to do is fill out all this information, call the insurance company, and then just have something, what you think is trivial, just slip your mind. Just forget the drug strength or the drug quantity. Most of the time, it'll get answered, because when you get to the prior authorization department, they're going to ask you for all this stuff systematically. But as you can see here, some of it has more than one step. You have to say you have active Crohn's disease and has tried prednisone or whatever other drug it is. If you just say tried prednisone and don't say you have active Crohn's disease, some of the technicians or pharmacists there might assume that you have active Crohn's disease, and it might get approved. But at the same time, if someone's is really going by the book, they might deny it. So depending on if the technician there wants to get through the case really quickly, they might just deny it for that because it takes less time, and it is technically true. They didn't put active Crohn's disease there. So make sure you have this rubric filled out in its entirety. After you've submitted all this information to the insurance company, make sure also at the same time that you ask for a stat request, because what this will do is it will shorten the compliance time to 24 hours. Now they only have 24 hours in order to get you that decision. And if you've submitted all this information, if they have all the information necessary to make a decision, then they're going to get you that approval within 24 hours. So if you submit it with all this information, like I said, it only takes about a couple minutes to approve. They're just going to look really quickly. They see all the information's there. The longest part is just going to be working through the claim system and just adding it in. So it should take about a total of 2 to 5 minutes, depending on what kind of claim system they're using. So I hope this is helpful. It's a bummer you got Crohn's, but hopefully this will at least alleviate the stress of having to deal with prior authorizations and the not knowing if something is or is not covered. This way you're going to know exactly what's going on. You're taking control of the situation. So I hope this was helpful, and I'll see you next time.